So today we will be talking regarding a very common and a non-cancerous tumors of the uterus called as the fibroids. What are fibroids? So fibroids are the excessive growth of the musculature of the uterus, and they are completely benign and non-cancerous. So what age do we see all this in? So fibroids can be seen at the youngest age of almost 13 to 14 years, and it can last almost up till 50 to 55 years. So how can fibroids bother you? So fibroids can cause lot of heavy menstrual bleeding. It can lead to a lot of pain during your periods, or it can also lead to bleeding in between the periods also. So along with all this, it can also lead to infertility if it is occupying a lot of space inside the uterus. So the fibroid size can vary from 0.5 centimeters, and it can also grow up to 15 to 20 centimeters as well. So what we always often get this question saying, what type of fibroids actually need treatment? Do all fibroids need surgery? No, definitely not. So, coming to the treatment of part of the fibroids, we always consider a few aspects. First thing is the age of the patient and what type of symptoms is the patient undergoing. And also, we have to see the type of the fibroid depending on the location of the fibroid. So, suppose a patient is young and that is in her reproductive age group, and she is suffering from infertility, and the fibroid is more than 4 centimeters, and it is sitting inside the uterus, definitely she will need a surgical treatment. Suppose a fibroid is somewhere in the exterior part of the uterus and measuring less than 5 centimeters, and she's been asymptomatic, then definitely she might not need any treatment but need a regular follow-up scans. So how we actually go on treating this type of fibroids? Those who need surgical treatment will be treated by a surgery called as the myomectomy in case of the reproductive age group females. For those who have crossed 45, we always advise hysterectomy for such kind of patients. So what type of surgery is myomectomy? So myomectomy is a major surgery in which we give a small incision over the uterus, and we will be extracting the fibroid out and cutting into pieces and removing it from the uterus. So this can be done by various methods. One is called as the open myomectomy, where we give incision over the abdomen, or we can do it by laparoscopy as well as robotic means. And also there are certain fibroids which lies just inside your uterus at the inner lining, which can be cut down by a method called as hysteroscopy. So these are the various methods in which we can remove the fibroids. So we also get one more question: can this be cured by medications? Well, medications might not act well on the fibroids if they are very huge. So medications are only indicated in case of fibroids if we are going for surgery, but we might need some more time so that her hemoglobin builds up, or we might have to shrink the fibroid and reduce the size of the fibroids. So medications will not act well on the fibroids. For those who are the fibroids which are more than 5 to 6 centimeters and symptomatic, definitely surgical management of fibroids will be a better option.